Good morning, early birds. Welcome to Virtual Abilities 2013 International Disability Rights Affirmation Conference. My name is Mprah India, and Tori Landau will assist me with the introduction, providing voice. If you need any assistance during the conference, please send an instant message to one of the VAI greeters. They are standing at the top of the aisles toward the back of the auditorium. If you are not familiar with our virtual ability community, please check the poster on stage to get our community note card. You can also visit our website, www.virtualability.org. To find out more about this conference and today's schedule, please look at the information here, blog.virtualability.org. The title of this session is Does Disability Matter? Disability in Sexual and Reproductive Health Policies and Research in Ghana. Persons with disabilities often face serious barriers to sexual and reproductive health information services due to institutional and barriers. Deaf people have unique communication and linguistic needs, often misunderstood or ignored even by others in the disability community. Dr. Wisdom Mprah is a teacher at the Mprah Secondary Technical School for the Deaf in Ghana. He has conducted studies on knowledge and use of contraceptives among deaf people in Ghana. And now we have to explain both a technological miracle and a technological failure. Where Dr. Mprah lives, the internet is intermittent. This past week, he has been without electricity for several days as well. Although he had previously sent in his text and his PowerPoint, he is not able to join us today. His avatar is here, however, and Vulcan Viper is willing to provide it with a voice. We've got Dr. Mprah's permission to go ahead and present his paper as if it were him presenting. Just remember that since Dr. Mprah isn't running his avatar, to instant message him. He gives his email to the PowerPoint so that you can contact him later. Therefore, through the magic and the mistakes of technology, let's begin.
This is Gentle, and I'm trying to run both avatars today, so I apologize. I want to thank Mprah and Tori, and thanks Vulcan Viper for providing Dr. Mprah with a voice, because he is deaf and he doesn't usually speak in public. So here, let's have his speech.
Does disability matter? Disability in sexual and reproductive health policies and research in Ghana. Wisdom Mprah. Introduction. The main themes of my talk today are as follows. Overview of Ghana, global overview of sexual and reproductive health, sexual and reproductive health in Ghana, government response, for this research I reviewed the following documents: Ghana Demographic and Health Survey, Ghana Population Policy, Adolescent Reproductive Health Policy, Ghana Reproductive Health Service and Standards, HIV/AIDS and STDs Policy, Law on Abortion, 2004 Ghana Adolescent Survey, a brief overview of the country of Ghana. It is a country in West Africa, a former British colony. We are a multilingual and multicultural society. English is a foreign language and is used for official transactions. A global overview of sexual and reproductive health. This is abbreviated SRH. $210 million women suffer from pregnancy-related complications. Half die from childbirth and other pregnancy complications. About 99% are in developing countries. STDs, sexually transmitted diseases such as gonorrhea, syphilis, chlamydia, and trichomonas, infect more than 340 million people each year. More than 25 million people have died of AIDS worldwide, and another 33.4 million are currently living with HIV/AIDS. Persons with disabilities at greater risk have sexual and reproductive health problems because they are generally poor, they lack access to health information, they are up to 3 times more likely to be victims of physical and sexual abuse and rape, they experience forced sterilization, they face forced marriage and forced abortion, but they are less likely to have access to physical, psychological, medical, and judicial interventions. What is the government's response? Providing information to influence behavior, alleviating poverty, conducting studies, appointing a presidential advisor, conducting studies to identify groups at risk, formulating policies, but persons with disabilities are unlikely to benefit from these interventions. Here are the methods for my research on this topic. The criteria I used for my selection of documents were relevance, source, coverage. So these are all targeted governmental sources, and I included one source from an NGO, non-governmental organization. You call them non-profits. Why did I study persons with disabilities? Little is known about them. However, studies indicate high HIV/AIDS infection rates among disabled people. E.g., studies in Nigeria, Kenya, and Swaziland indicate deaf people are a vulnerable group. The situation in Ghana is likely to be similar because they are not targeted and their needs are missing in programs and policies. They are poor, lack formal education, and are prone to sexual abuse. Again, a reminder of the documents I reviewed. I will go through each of them and tell what I found. Ghana Demographic and Health Survey. I reviewed the 5th survey, which is the latest. Variables considered were age, religion, sex, marital status, education, ethnicity, and place of residence. Disability was not considered, though it is a potential variable for vulnerability for sexual and reproductive health problems. It is unclear if persons with disabilities were included in the survey. Even if they were included, the report has no disaggregated data on disability. Ghana Population Policy. It was formulated in 1969 to address family issues. Then revised in 1994 to broaden scope to include HIV/AIDS, persons with disabilities, and aged. Persons with disabilities were put together under same heading and same strategies prescribed, so their unique concerns are unlikely to be met. Reproductive Health Survey Policy and Standards. It covered a wide range of SRH, preventive, and management measures, including decision-making on birth control by persons with disabilities. But there were a number of significant problems. Document focused mainly on birth control for, quote, mentally disabled, unquote, women. The policy states that decisions regarding family planning for the, quote, unquote, mentally disabled.
Hello?
Oh,
Hello? Hello?
This is the perfect hello?
Is this Dragon 36, sir? Is this Dragon 36?
I don't have a disability.
Send a message of love.
No
Hello?
disability.
Hello? Hello? Where are we?
I am sorry. Please do not speak in
You
Hello?
want to speak to me?
Please
Hello?
do not speak in the presenter.
Bye?
I thought we were here to talk about sexual disabilities. No, we are not police. We are simply expressing our opinions.
I'm not good. I am
Okay, sorry about that interruption. Vulcan, can you go back and pick up where you were?
Yes, I can. I took the precaution of marking the spot. There are some sirens going on here now. The policy states that decisions regarding family planning for the quote-unquote mentally disabled should be made by the next of kin. But document did not define mentally disabled, thus may infringe on the rights of women with various cognitive disabilities who have the capacity of independently making SRH decisions. The policy treated the concerns of those labeled mentally disabled not differently from the concerns of women generally, assuming the two groups would have the same SRH concerns and needs. The policy ignored people with other forms of disabilities. The policy seemed to be primarily more concerned with the reproductive functions rather than overall SRH concerns of persons with disabilities. Adolescents' reproductive health. It was a formulation to deal with the special needs of adolescents because other policies were too general to address their needs. It identified commercial sex workers, street children, teenage parents, adolescent couples, young people living with HIV/AIDS, marginalized groups, females in shrines, and people labeled as mentally disturbed, physically challenged, as special groups who need attention. However, there is very little in the policy to serve as guidelines for defining the targeted individuals. For example, who are the... Let me read that again. However, there is very little in the policy to serve as guidelines for defining the targeted individuals. For example, who are the mentally disturbed or the physically challenged population. It is also not clear if people who are deaf and blind form part of the physically challenged population. National HIV/AIDS and STI policy. It was formulated to tackle the ever-increasing HIV/AIDS prevalence in Ghana. It targeted young people and women as a vulnerable group who need to be empowered. But there is no mention of disability in the document. Criminal Code and abortion. This has an implication for reproductive health, though not a policy. It focuses on the reproductive functions of women with disabilities and termination of fetuses that are considered, quote, abnormal, unquote. Although abortion is illegal and a criminal offense in Ghana, it can be done for female quote unquote idiots and those situations where there is substantial risk that if the child were born, it may suffer from or later develop a serious physical abnormality or disease. These provisions are problematic because firstly, they are discriminatory and infringe on the reproductive rights of women with disabilities, especially those with developmental disabilities. Secondly, the determination of persons with disabilities who cannot make such decisions will be hard. Thirdly, the law is not clear on what constitutes serious physical abnormality or how to define a female idiot. (2004) 2004 National Survey of Adolescents. The National Survey of Adolescents was launched in 2004 in 4 sub-Saharan African countries: Burkina Faso, Ghana, Malawi, and Uganda. It was conducted under the Alan Guttmacher Institute's project Protecting the Next Generation, Understanding HIV Risk Among Youth, and supported by the Bill and Melinda Gates Foundation. Findings show adolescents have serious sexual and reproductive needs. Also, the reports identified groups at high risk of sexually transmitted diseases, or STDs. Street children, young girls, now let me continue. I'm not sure exactly where I was, so a bit of it may be repeated. Also, the reports identified groups at high risk of sexually transmitted diseases, STDs, street children, young girls living in traditional shrines known as the Trokosi system, and HIV/AIDS orphans. However, persons with disabilities were not mentioned, although they are equally at high risk and missing in many studies on STDs. In conclusion, cursory attention has been given to people with disabilities. Attention is focused mainly on the negative, Their reproductive rights are controlled by other people. Abortion is permitted where it can be determined that the child will be born with severe physical deformities. Their needs are grouped together with other groups, for example, the aged. Possible reasons for this neglect include negative perceptions and attitude towards persons with disabilities, persons with disabilities are not considered sexually active. Persons with disabilities may not be perceived as contributing to population growth. The economic productivity of persons with disabilities is often perceived as insignificant. Donors may have their own agendas, which are often tied to the policies of the aid they provided for various programs. Some implications of this research: it provides perspective on the need to target specific subgroups which many policies and programs tend to ignore. For example, some groups defined by socio-demographic characteristics such as age, gender, or educational attainment are more vulnerable to SRH problems than the general population. However, as indicated in the review, the association between disability and risk for SRH problems has received little attention in Ghana. This review sought to broaden the conception of vulnerability to include disability. Overall, we can conclude that there is the need for a clear understanding of the concerns of persons with disabilities and more concerted efforts on the part of the government and other stakeholders to guide the development more inclusive policies, programs, and services. Thank you for coming to this session today. I am sorry I am unable to respond to questions and comments directly. However, here's my email. When I have internet access, I will be happy to respond. The email address is shown on the slide.
This is Gentle, and I want to thank Vulcan. This is something I normally don't ask people to do, but Vulcan is pinch hitting, and he was reading live in not his first language. I want to thank Dr. Mprah for trying so hard to attend with us today. I'm really sorry that we weren't able to offer full interaction with him, and I'm really glad that we have heard this information. I think it's something we definitely need to think about. I want to thank the audience for participating. Did you learn something new today? I know I sure did. So I'm hoping that you will post some comments on the blog entry, and then when Dr. Mprah gets his internet back, then he'll be able to see that. I learned a lot of new things too, Letty. I want to thank iSky because she has organized this whole conference of 2 days. Good for you, Anya. And Kara has been very nice about doing all of the reading. That's been helpful. And I want to thank Dusa and Metaverse Television. They are filming this early in the morning and streaming live so that our non-SL friends can look at these things, including the briefing. Sorry about that. And if you would like, you can give that information to your friends and they can watch it online. Thank you, Dusa. It is amazing information. It really is.